of the pandemic right now, the governor recently signed an executive order to speed up the release of hundreds of people at state correctional facilities. We're here for you. We listen to your concerns. In our Rebound Maryland series, WMAR 2 News' Mark Roper explains why some say the release of prisoners is not happening as quickly as they hoped it would.
Secure gates and barbed wire are not enough to stop the coronavirus from making its way inside Maryland prison walls. So far, the Department of Public Safety and Correctional Services reports 127 officers, 45 inmates, and 8 staff members tested positive for COVID-19, and 1 inmate has died. It has Debbie Whitcomb worried about what precautions are being taken to keep her son safe behind bars. She declined to name him in an effort to protect his identity.
Up till 2 days ago, he didn't have a mask, and he does not have cleaning supplies. He has not had cleaning supplies for several months. They're not able to stay 6 feet apart.
Governor Larry Hogan changed his stance on releasing inmates and recently signed an executive order to free certain people from prison. But criminal justice advocate Nicole Hanson-Mundo believes it's not happening as fast as some hoped.
We are seeing people come out sporadically, right, but not in the massive numbers that they should be coming out.
With a total prison population around 19,000 inmates, state correctional officials released more than 2,000 people from Maryland jails and prisons during the last 5 weeks of the coronavirus outbreak, even before the governor's order on April 18th. Those who are eligible to get out of prison early were already scheduled for release within the next 4 months, or inmates convicted of nonviolent crimes age 60 and up.
In our jails and prisons, case managers aren't working. And those are the people who help to facilitate the release of our loved ones.
They're difficult to get a hold of. I've never spoke to Chief of Security yet. I leave messages, and the case manager, the staff is very limited in there now.
We asked the Maryland Department of Public Safety and Correctional Services for an interview about the release process, but we were told they are not able to accommodate interviews about the issue at this time. Meanwhile, Whitcomb says her son is already eligible for an early release in April because of good behavior, yet he's still sitting in prison.
And he's required a lot of good days. And so he would have to write in order to get out sooner. He had wrote in April, and she said it was too soon, so he had to write back in May.
Prisoners eligible for release would be placed on home detention or supervised on pretrial release. Meanwhile, part of the solution may be part of the problem, leading to any potential disappointment in delays.
From what I'm hearing on many of these calls, pretrial is trying, but as people begin to be approved, the courts in pretrial are going to be inundated with names of people who have to be approved to go home.
And for those still waiting for an early taste of freedom, there are questions about the existing quality of health care in prison. Whitcomb's son has asthma and says it can take days for him to see a doctor.
So my concern is if he would contract COVID-19, he would be sick for days before he gets to go to the doctor. And if it gets in his lungs, it could be fatal.
Whitcomb has already lost one son, killed in a car crash after he had just turned 21.
And so my heart was so broken that now I'm so scared to lose him, to this virus, because he does have asthma really bad. And so it just, I'm so worried. Just so worried.
Mark Roper, WMAR 2 News.